The day it happened, Tara Novak was running on 4 hours of sleep and her third cup of vending machine coffee. She hadn't planned to stop at Hargrove's, the grocery store on the corner of Elm and Fifth that everyone in Millbrook, Ohio used because it was the only one within reasonable distance. She needed eggs and ibuprofen and maybe something she could call dinner that didn't require more than 5 minutes of effort. She was still in her scrubs, teal, faded at the knees, with a small bleach stain on the left sleeve she'd given up trying to explain away. 12 hours in the ER at St. Benedict's left its marks, and Tara had learned to stop being embarrassed about it. She grabbed a basket by the entrance and moved through the produce section with the mechanical efficiency of someone who had been awake since before most people set their alarms. Her hair was pulled back in a bun that had held through a 6-car pileup, 2 cardiac events, and a pediatric trauma that she still wasn't ready to think about. She didn't feel like a nurse at that moment. She felt like a person who needed eggs. She was reaching for a carton near the back of the refrigerated shelf when she heard the voice. Excuse me, are you seriously going to stand there and block the entire aisle?" Tara stepped aside without looking up. She assumed it was meant for someone else. It usually was. "I'm talking to you," she turned. The woman standing behind her was somewhere in her mid-50s, dressed in the kind of effortless casual that costs real money. A cream-colored blouse, pressed slacks, hair that moved like it had been professionally arranged that morning. She was holding a small handbasket and looking at Tara the way people sometimes look at things they've stepped in. "Sorry," Tara said, "because it was automatic. I was just grabbing." "You people never pay attention," the woman said, not quietly. 2 other shoppers glanced over from the next aisle. "It's like you don't even see anyone else around you." Tara blinked. She wasn't sure she had heard that correctly. "I'm sorry, I moved over. I didn't realize I was in the way. It's not just that." The woman's voice had that particular kind of edge, not loud enough to be a scene yet, but loud enough. Calibrated. "It's the attitude. You come in here looking like that." And her eyes moved down Tara's scrubs with a slowness that was unmistakably contemptuous. "And you act like you own the place." Tara stood very still. She recognized this moment. She had been in versions of it before, not this exact configuration, but the shape of it. The moment where someone with enough certainty in their own importance decides you are an appropriate target. The moment that has nothing to do with eggs or blocking an aisle. "I just came to buy groceries," Tara said. Her voice was even, practiced, then maybe put on real clothes first. The woman smiled. It was the kind of smile that expects no consequences. "Hospital staff track all kinds of germs, you know. It's inconsiderate to come out in public like this. Some of us have children." A beat of silence. A woman with a toddler in her cart had stopped several feet away, watching. A teenage stock boy near the dairy cooler had gone still. Tara felt the exhaustion of the day press down on her shoulders like something physical. She thought about the 12-year-old she'd coded that morning. She thought about the family in the waiting room and the way the father had gripped the armrest. She thought about peeling off her gloves at the end of her shift and thinking, today was enough, today I did enough. She picked up her carton of eggs. "Have a good evening," she said, and turned to go. "That's right," the woman said, louder now. An audience gathered whether she wanted one or not. "Don't have anything to say for yourself." Typical. Tara kept walking. Her jaw was tight. Her eyes were fixed on the end of the aisle. There was a specific kind of humiliation that came not from being wrong, but from being treated as though your dignity was optional, and she felt it now, hot and quiet in the center of her chest. She made it 3 steps before she heard the sound. Nails on linoleum, the soft jingle of a vest clip, and then a voice, low, unhurried, the kind of voice that didn't need to raise itself to be heard. "Evening, ma'am." She turned. He was standing at the end of the aisle. Tall, mid-30s, wearing a plain gray t-shirt and dark jeans. There was nothing dramatic about his appearance, nothing that announced itself. No uniform, no insignia, just a man, and at his left side, seated so precisely it seemed almost architectural, a Belgian Malinois with a working dog vest and the kind of stillness that only comes from years of discipline. Tara didn't know him. She had never seen him before in her life. But the dog looked at the woman in the cream blouse, and the woman looked at the dog, and something in the air shifted. His name was Declan Marsh. He had been home from Fallujah for 6 years, and from Kandahar for 3, and he had spent the better part of his adult life learning how to read a room. He read this one in approximately 4 seconds. He had come in for protein bars and wasn't looking for anything else. But he had been standing at the end of the aisle for longer than the woman in the cream blouse realized. Long enough to have heard everything. Long enough to know exactly what kind of moment this was. "Bricks, stay," he said quietly. The dog didn't move. He walked toward Tara, not toward the woman, not toward the scene, but toward Tara specifically, and when he was close enough, he said, "You left your card at the register," and held out a small folded piece of paper. She stared at him. She had no idea what he was doing, but he met her eyes for just a half second, and something in his expression said, "Play along." "Oh," she said. "Thank you. They wanted to make sure you got it back." He turned to the woman then, not with hostility, not with performance, just the quiet kind of acknowledgement that says, "I see you and I'm not interested in pretending otherwise." "I heard most of that," he said. "I want to make sure I understood correctly. Were you talking about the hospital scrubs? Because she came from St. Benedict's." The woman straightened. "I don't see how that ER had a bad morning," Declan said. He said it the same way he said everything, flatly, without inflection, like he was reading a weather report. "Multi-vehicle accident on Route 9. 4 critical. I drove past it at 6 a.m. He paused. "She works there. Judging by the bleach on her sleeve, she was there through all of it." The woman opened her mouth. "That's not a criticism," he said before she could speak. "I'm just making sure I have the right picture. Because it changes things when you have the right picture." He didn't wait for a response. He turned back to Tara and said, in a completely different register, the kind you use when you're just 2 people in a grocery store, "They have better eggs in aisle 4, if you care. The ones here aren't great." Tara looked at him for a moment. The tight thing in her chest had loosened slightly, without her meaning to let it. "Thank you," she said again. This time she meant something different by it, and they both knew it. She followed him toward aisle 4. Behind them, the woman in the cream blouse said nothing. The teenage stock boy near the cooler went back to stacking yogurt. The woman with the toddler pushed her cart away. Nothing dramatic happened. There was no scene, no confrontation, no moment where someone said something devastating and everyone clapped. The world didn't reorganize itself in a satisfying way. But a small and specific kind of cruelty had been interrupted, and that was its own thing. In the next aisle, Tara set her basket down on the floor and pressed her fingers against the bridge of her nose. The adrenaline was leaving now, leaving the exhaustion underneath it very clear. "You okay?" he asked. "I'm fine." She picked up a carton, set it back down. "I hate that I said sorry. I said sorry to her and I didn't do anything." "Yeah," he said. "That's the part that stays with you." She looked at him. "Did you actually hear it? The accident on Route 9? "I did. 6 in the morning. It woke up half the block." A pause. "I figured it was connected. The scrubs, the time of day. You figured I make a habit of it." He looked down at Bricks, who was sitting attentively at his left heel. Bricks helps. People think twice, sometimes. What does he do, exactly? The question came out before she could decide if she was asking it. The vest, is he a service dog or working? Declan was quiet for a moment, not the evasive kind of quiet, the measuring kind, both depending on the day. He was military working dog. 3rd deployment. He came home with me. He said it without ceremony. He keeps me from getting too far inside my own head in certain situations, and in other situations he's just a very large dog that people find difficult to ignore. The corner of Tara's mouth moved, almost involuntarily. He ignored her pretty specifically. He's trained to wait. He doesn't like it when I don't need him. He always thinks he knows better. A beat. He's usually right. She picked up another carton, checked the dates. "Declan," she said, reading the name off a gym bag he was carrying. She wasn't sure why she did it. Something about the situation demanded a name. "That's right," he said. "Tara Novak." She held out a hand. Nurse. Sorry about whatever that was. You don't need to apologize for that. Force of habit." He shook her hand. It was a brief and uncomplicated gesture. His grip was the kind that had held a lot of things and knew exactly how much pressure was enough. They stood in aisle 4 for another minute, in the particular awkward comfort of 2 strangers who have seen each other at a slightly more honest angle than usual. Brick sat between them and panted with an expression of mild professional boredom. "I'm going to go pay," Tara said eventually. "Yeah." He reached past her for the protein bars. "Take care of yourself." She walked to the register and thought, for reasons she didn't entirely understand, that she would probably not stop thinking about this for a while. She was right. 3 days later, she was back in the ER when the call came in. She almost didn't register the name at first. The paramedics were bringing in a K9 officer. That was how it went over the radio. K9 officer, GSW to the right shoulder, stable but losing ground. Tara was gloved and at the bay by the time they came through the doors, and she had already started reading the chart before she looked at the patient's face. Declan Marsh. He was conscious. Barely. His face was the color of old cement, and he was doing that thing people do when they're managing pain at a level that requires active attention. Eyes slightly unfocused, jaw set, breathing shallow and deliberate. Brix was not with him, and it was the first thing she thought of when she saw him. She didn't know why that was the first thing. "He's going to ask about the dog," one of the paramedics said, reading her expression somehow. "He already asked the truck." "Dog's fine. Took a graze, animal control has him. Tell him," she said. "The second he can process it, tell him." They told him. She watched the specific kind of tension leave his body. Not all tension, not the pain, but one specific kind. She cataloged it without thinking. After 8 years in emergency medicine, she had learned to read the difference. She worked on him for 2 hours. The bullet had clipped the deltoid, missed the axillary artery by a margin that would keep her thinking about probability for the rest of the week, and left a mess that needed cleaning, suturing, and more patience than the situation rewarded. He was quiet throughout. Not unconscious, just contained. He answered questions when she asked them. He didn't complain. At some point, when she was running a secondary check and he was more coherent, he looked at her and said, "Tara Novak, that's right," she said. "Our nurse." Still yes. He was quiet for another moment. Small town, small state. She finished what she was doing and stripped off one glove to note something on the chart. "You're going to be here for a few days. The shoulder's going to need monitoring. You'll have restricted movement for 6 to 8 weeks. I know. You can't use it the way you were using it. I know that too." She looked at him. He was looking at the ceiling, which meant he was thinking about something he wasn't saying. She had seen enough patients to know when someone was doing the math on their own life, calculating how this would change the shape of things. "Brix," she said, "will he be all right without you for a few days?" Something in Declan's expression shifted. "He'll be with Archer, my team. He'll be fine. He's done it before." A pause. "He won't like it. He never likes anything," Tara said, remembering the expression of professional boredom. The corner of Declan's mouth moved. "No, he doesn't." She left him and went on to the next patient, and the one after that and the 7 that followed. She didn't go back until the end of her shift, when she was passing his room on the way out and stopped, not because she had meant to, but because she did. He was awake. He had a folder open on the bed beside him, something official looking, and he was reading it left-handed with the focused concentration of a man who intended to be useful as quickly as possible. "You should be sleeping," she said from the doorway. "Probably." He didn't look up immediately. "How was the rest of your shift?" She considered the question. It was an unusual question. Most patients did not ask about the rest of her shift. "Long," she said. "Typical. I'll sit down for a minute," he said. "You look like you've been standing since Tuesday." She sat down. She wasn't entirely sure why. Later, she would decide it was because she was genuinely tired and the chair was there, and that was enough of a reason. "What happened?" she asked. "If you can talk about it." Domestic call. Guy had a weapon. Situation got complex. He said it the way people do when there are details that belong to other people. Not secretive, just careful. "Brix got between me and him. He's going to get a commendation, and he's going to be furious that he can't attend the ceremony. Can dogs be furious? This one can." He finally looked up. "Are you off now?" "I am. You live nearby?" 20 minutes. "Good." He went back to his folder. "Get some sleep." She stood up. At the door, she stopped again. "The grocery store," she said. "You didn't have to do that." He looked at her over the folder. "I know." "Why did you?" He thought about that for a moment with the seriousness it deserved. "Because you said sorry when you didn't have anything to be sorry about," he said. "And you were going to keep walking and let it happen. And I've spent a lot of years watching what happens when people let things happen, because it feels easier than not letting them happen." She stood with that for a second. "Okay," she said. "Okay," he agreed. She went home. She slept better than she had in a week, which she decided not to analyze. Declan Marsh stayed at St. Benedict's for 4 days. Tara was not his primary nurse. The assignment system didn't work that way, but she checked in on him during each of her shifts, and gradually the checking in became less professional and more something else, which neither of them named, but both of them knew was happening. On the third day, Brix was brought in by a man named Archer, who was large and deliberate, and who looked at Tara with the evaluating eye of someone used to assessing situations for risk. The dog went directly to Declan's bedside and sat there with the gravity of a guard taking a post. Then he put his head on the edge of the mattress and exhaled heavily. "He's fine," Declan said. "That's just his opinion of the situation." "His opinion seems mostly resigned," Tara said. "He's always mostly resigned. He prefers active deployment." Declan scratched behind the dog's ears with his left hand. Brix closed his eyes. He tolerates everything else. Archer looked between Tara and Declan with an expression that said, "I've seen this before. I know what this is. I'm going to say nothing." He said nothing. On the fourth day, Declan was discharged with a prescription, a follow-up appointment, and written instructions he clearly intended to modify to his own specifications. Tara was on shift, and she caught him at the nurse's station on his way out, filling out a form left-handed with the careful concentration of someone learning a new skill. "You're going to follow the instructions," she said. "Some of them. All of them." He looked up. The physical therapy schedule is aggressive for someone who isn't in a clinical environment all day. That's why it's called a schedule and not a suggestion. He looked at her. She looked back. Brix, on his left, glanced between them with the measured attention of a referee trying to determine if anyone needed to intervene. "All right," Declan said. "The instructions." "Thank you." He picked up the folder. He started to go. He stopped. "Do you have a preference," he said, without turning, "about the kind of place you eat dinner? Specifically." There was a pause in which Tara processed the sentence structure. "I don't follow you," she said. "I'm asking if you want to have dinner with me." He turned around. His expression was exactly the same as it had been in the grocery store, level, unhurried, a little dry. "At some point when you're not working and I'm not in a hospital bed, if that seems reasonable." "It seems reasonable," she said. Okay. He left. Brix walked beside him with the satisfied confidence of a dog who had been watching this particular situation for 4 days and was pleased to see it reach the logical conclusion. At the nurse's station, Tara's co-worker Faye, who had been pretending to chart for the last 3 minutes, put down her pen and said, "That's the one from the grocery store?" Tara did not answer, which was itself an answer. "I've been here 8 years. Faye said, "and nobody has ever asked me to dinner by saying, 'Do you have a preference about the kind of place you eat dinner specifically?'" "It's a work in progress," Tara said. But she was already smiling. The dinner was on a Tuesday, the one day both of their schedules aligned, which had taken 2 weeks to negotiate, and which felt, to Tara, less like romance and more like logistics, which she found oddly reassuring. He took her to a place called Whitman's, on the edge of town, the kind of restaurant that had been there for 30 years and hadn't tried to become anything other than what it was. Good lighting, small tables, food that tasted like someone had made it rather than assembled it. Brix was not with him, which surprised her. Archer has him," Declan said when she asked. "He tries to attend every first dinner I've been on in the last year, and I've started finding it counterproductive." "How many first dinners have there been in the last year?" "1." He said it flatly. She wasn't sure if he was serious. His face, she was learning, maintained the same expression for a wide variety of information. "Are you telling the truth?" she asked. "I find lying inefficient," he said. She laughed. It was a genuine laugh, sudden and slightly surprised. He seemed to note it the way he noted most things, with that careful attention that wasn't surveillance exactly, just presence. They talked for 2 hours. She learned things about him in a specific order, his years in the Marines first, because he mentioned them in passing. Then Brix, because once she asked, he talked about the dog with a particular kind of animation that didn't show up elsewhere in the conversation. Then his family, a sister in Cleveland, parents in Phoenix, relationships maintained by phone calls that he described as structured. "What does that mean?" she asked. "It means I call every Sunday, we talk for 30 minutes, we've done it for 12 years, and everyone finds it more comfortable than trying to have unpredictable emotional conversations." "That's bleak," she said. "It's functional," he said. "Different people mean different things by closeness." She told him about Millbrook. She had grown up here, had left for nursing school in Columbus, had come back because her mother had gotten sick, and then had stayed because she'd gotten used to it again. She told him about the ER with the honesty you can have with someone who has their own version of difficult work, the days that stick with you, the specific exhaustion of caring about people when caring is depleting, the small victories that don't look like much from the outside but weigh something real. He listened. She'd noticed that about him in the hospital. Not just hearing but listening, the kind where you don't fill in the pauses, where you let the other person finish the sentence they're actually trying to finish. When the check came, they argued briefly about it in the low-stakes way of two people who both intend to pay and both find the performance of insisting slightly tedious. He paid. She noted it. She let it go. Outside on the sidewalk, the fall air had a bite that the restaurant had insulated against. This was good, she said. It was. He glanced down the street. Do you want to walk? There's a path along the river. It's about a mile. Yes, she said, without thinking about it. They walked along the river path in the specific kind of silence that isn't uncomfortable. The water was dark and moved quietly, and the trees on either bank had started turning. Tara thought about the grocery store. The exact moment when she'd been walking away from that woman, when the specific helpless anger of being treated as negligible had been settling in, and she'd heard nails on linoleum. She thought about turning and seeing him there, a man she didn't know, standing at the end of the aisle like he'd happened to be exactly where he needed to be. Can I ask you something? She said. Yes, in the grocery store. You didn't know me. You had absolutely no reason to involve yourself. No, he agreed. So why? She paused. And don't say because it was the right thing to do. I want the actual reason. He was quiet for a moment. They walked past a bench, past a section of railing where someone had attached a padlock that was oxidizing slowly. I watched my mother get talked to like that, he said. For most of my childhood. By my father, mostly. Sometimes by other people. He said it without dramatics, the same even delivery as everything else. But she felt the weight of it anyway. She was a nurse too, actually. Worked nights in a county hospital for 22 years. She never once said sorry when she hadn't done anything wrong. A pause. But she stopped herself from saying things she should have said because it seemed easier, and it wasn't, eventually. Tara was quiet. I see that look, he said. The one people have when they're about to say they're sorry that I told them that. I was going to say it, she admitted. I know. I'll hold off. I appreciate that. She watched the river. A leaf moved past on the surface, flat, spinning slightly, going wherever the current decided. Your mother, she said eventually. She's in Tucson now. Retired. She plays pickleball 3 days a week, and she's apparently very competitive about it. Good, Tara said with feeling. She'd like you, he said. He said simply, like a fact. She looked at him. He was watching the water. You don't know me very well, she said. I know enough. He glanced at her. She likes people who don't say sorry when they haven't done anything wrong. The river moved. The trees moved. Somewhere behind them, the town made its usual quiet nighttime sounds. A car, a dog barking, someone's porch light coming on. I said sorry in the grocery store, Tara said. You did, once. And then you stopped. He put his hands in his jacket pockets. That counts for something. She thought about the woman in the cream blouse. She thought about the moment she had turned to leave, the deliberate way she had set her expression and started walking, the way she had told herself it wasn't worth it. It was fine. It was easier. She thought about the way easier and worth it had been getting harder to separate lately in a way that had started to worry her. I've been thinking about that, she said. The sorry thing. I do it a lot. At work, I mean. I say sorry to patients who are being difficult because it diffuses things. I say sorry to doctors who talk over me because it's faster. I say sorry to. She stopped. I think I've been practicing it wrong. Yeah, he said. That's all? Just yeah? What do you want me to say? I don't know. Something more. He thought about it for a moment. You spent 12 years learning how to take care of other people, he said. You're good at it. The fact that you're still figuring out how to take care of yourself at the same time doesn't make either of those things less true. She walked with that for a minute. Okay, she said. That was actually more. I have moments, she laughed again. The river turned around a bend and they turned with it, and the path opened up to a wider clearing where the sky showed through the trees, and Tara could see the first stars appearing in the eastern dark. She thought, I do not know what this is yet. I do not know if it will become anything, or if it will stay at the size it currently is, which is already unexpectedly large for a thing that started in a grocery store aisle with a carton of eggs. She thought, but it is something, and that is enough for now. They walked back to the parking lot the same way they had come, through the quiet dark, and when he said goodnight, it was with the same uncomplicated directness he brought to everything. No performance, no ambiguity. Just a clear and simple thing that meant what it said. She drove home on roads she had driven since she was 16, through a town she knew the particular grammar of, and she thought about her mother's kitchen table, and about the pediatric trauma from 3 days ago, and about the woman in the cream blouse, and about a Belgian Malinois sitting with bored precision on a grocery store floor. She thought about the way some things happen in increments, the way a bad pattern becomes familiar, so slowly you don't see it solidifying, and the way it sometimes takes a stranger at the end of an aisle to make the shape of it visible. She thought about the fact that she had said sorry in that grocery store, and then she had stopped. She thought, that counts for something. She pulled into her driveway and sat in the car for a moment with the engine off, listening to the night. Her phone said 9:47. She had a 6 a.m. shift. She went inside. She made tea. She sat at her kitchen table in the specific tired but awake state that she recognized as her own particular version of peace, and she thought about Tuesday and the river, and a man who paid attention the way most people don't, and a dog who tolerated everything with dignified disapproval. And for the first time in a while, when she thought about tomorrow, the ER, the 12 hours, the work that gave and took in equal measure, she felt something that wasn't dread. She felt like herself.